Now, over 100 frontline workers, including doctors and nurses, have cautioned the Electoral Commission against the upcoming voter registration exercise. According to them, the exercise could compromise the health sector, leading to mass infections of COVID-19 and possibly mass deaths. In an open letter addressed to the chairperson of the Electoral Commission, the health workers disclosed that currently 25 doctors in the Ashanti region have tested positive for COVID-19 and over 100 nurses are infected in the same region. The situation, they say, closely mirrors what is going on in other regions. Dr. Pius Isando is a public health practitioner and one of the concerned doctors sounding the alarm bells. He joins us via Zoom right there. Doc, thank you for your time. Why is this necessary? We've got just a few days to begin this exercise of registration.
All right, Mama V, thank you so much, and good afternoon to you. And let me take this opportunity to also greet viewers and Ghanaians across the country. Let me indicate that this was an open letter which was penned by a heterogeneous group of medical professionals, and it was directed specifically to the Electoral Commissioner. And the reason for this decision to petition the Electoral Commissioner is because she has the mandate to compile the electoral register. Let me quickly indicate that we have found it upset that there's a lot of interest by some political actors, and it's even interesting to know that there's so much interest by the Deputy Minister of Health and attempts to shadow the content of this petition. One, we've also noticed attempts to even implicate members of this group. There are attempts to induce members who have willingly given their blessing to this petition out of their genuine concern as medical practitioners. And there are inducements being offered these by faceless people with calls since yesterday, trying to induce our members who have taken this action just out of their own conviction and out of their love for this country.
When you say the calls for some persons to induce your members, what exactly are they asking them to do?
Our members have been offered benefits in the form of cash, other inducements to denounce their association with this petition.
And have they? Have they?
Come again?
Have they?
If they had, probably you would have heard about it, but I just want to put this out so you know what's...
Okay, great. Dr. Isando, if you can hear me, there's a second leg of this. The Electoral Commission has outlined comprehensive... Dr. Isando, I'm just asking, the Electoral Commission has outlined comprehensive plans to ensure applicants adhere strictly to the protocols that have been issued. Is that not enough?
All right, Mama V. So this petition was written with a lot of perspective from the public health perspective. And that's the professional perspective that we want to solely dwell on, since that is the sole motivation for this petition. One, and let me take my time to go into details so that I can land on your question. One, without doubt, when you come into the West African sub-region, Ghana seems to be one of the very high-level players when it comes to COVID-19 infections. As at the time we put this petition out, we had just about 14,500 cases. And by evening, after just 4 hours of putting this out, this number had ballooned to 15,000, indicating an increase in 500 in just one day. In fact, less than a day. Similar numbers over this month, all the days we've been recording not less than 200, 250, sometimes 400, and sometimes a peak of even 500 cases. Again, at the beginning of this month, we had just about 38 deaths recorded nationwide. And you would agree that the number has soared to 95, which indicates that the number of deaths is also rising over time. Now, within the medical fraternity, we've also not been spared, as we've lost dignified, venerable colleagues like Dr. Jacob Planju. We've lost Dr. Harry Boateng at the SDA hospital. We've lost the nurse, Madam Sophia Addo, and we've also lost a medical lab technician. And we want to say that the lives of our medical practitioners matter, and efforts should be made to protect the general citizenry and consequently also protect the lives of doctors.
Is this letter coming out of fear?
Coming back to the question, I think we all witnessed even what happened over the weekend as far as the parliamentary primaries were concerned. And this was also superintended by the same Electoral Commission. We all saw how principles like social distancing, physical distancing, hand washing, wearing of face masks were disregarded by the delegates who represent a cross-section of the country. And let me sound caution that that is a small fraction of the number of people who will be partaking in the mass registration if this exercise is allowed to continue.
So Dr. Pius Esando, apologies there. So you're looking at what happened in the primaries and you're thinking that that could be replicated in the upcoming voter registration exercise. That's why you wrote an open letter to the Electoral Commission.
Not exactly that alone, but coming events do cast a shadow. This was an exercise that was superintended by the same Electoral Commission, and this is an exercise. But this was purely an NPP exercise, which was supervised by the Electoral Commission. I wanted to put that in perspective. Yes, and I want to put it in a bigger perspective that's even a small microcosm of the bigger picture that we are thinking about. And it's an exercise superintended by the same agency which talked about these principles about a month ago. Unless you want to tell me that as an agency talking about some principles within a month. Okay, so because of time, I want to fast track this because of time. What was your expectation of the Electoral Commission in the just ended exercise? What were you expecting the Electoral Commission to do? One, if this is a smaller picture of what is to come, and this involves fewer people. For instance, there should have been strict adherence to physical distancing, social distancing, ensuring that wearing of face masks is compulsory, ensuring frequent hand washing by people. And when we talk about hand washing, we've gotten into a mindset that a single hand wash, for instance, is protective as far as this disease is concerned. But we know that is not true. So, Dr. Esando, have you received a response from the Electoral Commission or the Commissioner? We are waiting a response from the Electoral Commission, and that's why we find it absurd. We find it very capricious that at this moment that we have written a letter that is directed towards an agency. And beyond the letter, organizations and parties which do not represent that agency seem to have taken the lead. Some of these individuals who rode on the back of this same disease to prominence and to become we get that point. We get that point, Dr. Esando. Just the last bit. Beyond the open letter, what are you hoping to do? All right. For us, I think first and foremost, I want to acknowledge all health workers who have been in the front line as far as this disease is concerned. All right, very well, Dr. Esando. That's what time would allow us. Thank you very much for your time. That's Dr. Pius Esando joining us there, talking on the back of an open letter that a group of health practitioners have written to the Electoral Commissioner.